All right. Good morning, everyone, and we welcome you to the today's session of Pediatric Constipation brought to you by Apollo Cradle of Greater Noida Center. We have with us Dr. Alok Kumar Gupta. He is our internal neonatologist and pediatrician associated with Greater Noida Center of Apollo Cradle, and he's going to talk about this topic. So this is something very common, which many mothers keep thinking कि constipation हो गया तो क्या करना है. So we have our doctor here who would be talking about this. To give a brief background about a doctor, he is a consultant. He's done his MBBS and DND in pediatrics, and he has done his fellowship in neonatology and MNAMS and MIAP. And he's a very senior consultant of neonatology and pediatricians associated with us. So, doctor, we're looking forward to hear from you on this topic. It's there for you.
Okay. Good morning, everyone. My name is Dr. Alok Gupta. First, we will talk about pediatric constipation, mainly about functional pediatric constipation. As we know nowadays, about 30% children are suffering from pediatric constipation during some stage of their life. First, before constipation, we have to understand what is normal stool pattern in children. Normal stool pattern in children varies with the age. Stool pattern is less than 1 month of life, depend upon the whether baby is on exclusive breast milk or formula feed. If baby is on exclusive breast milk, stool frequency is more. It varies from the 1 per day to 10 per day. If baby is on formula feed, stool frequency is slightly less. It is 1 per day to once in 5 days. It's also common. After 1 month of life, stool frequency is less. It is 1 to 2 per day, mainly semi-solid. Uh, After 1 to 2 years of the age, stool frequency is 1 to 2 per day. It is mostly well-formed stool. And when we have to level constipation in children, in constipation, there is delay or difficulty in defecation in children. Stool frequency is 2 or less than 2 per week. It should be sufficient to cause significant distress to the family and the children. There is something called encoparesis, in which there is an involuntary swelling of the undergarments of children with feces. It is an indicator of constipation. Frequency of this occurs at least one or more than one time per week. Children have frequently having painful or hard bowel movement. They have large diameter stool. They have excessive stool retention, termed as withholding maneuver, with parents and family believe mistook it as a passing of the stool. On the contrary, child withhold the stool. During this phenomena of withholding maneuver, child screams in the pain, child cross their legs, then child face turned red, child frequently hides under the bed behind the door, and child squeezes their external anal sphincter and they squeeze their gluteal muscles, which pushes the stool up higher in the rectal wall and reduces the urge to defecate. In this, child refuses to sit on the toilet, rise on their toes. Parents mistook as an urge to defecate. On the contrary, child withhold the stool, doesn't want to pass the stool. It is to keep in mind that the consistency and shape of the stool is more important as compared to frequency of the stool in defining constipation. Constipation, now we will come to about types of constipation. Constipation is frequently of two types. First is the organic constipation, and second is the functional constipation. Organic constipation is less common. This is 10 to 20% of cases, and while functional constipation is more common, 8 to 90% of cases. It is now it's the most common cause of constipation, and at least 3 out of 10 children are suffering from it during their lifetime. So then, how to identify the functional constipation? First, the age of onset usually occur 1 to 2 years of the age. It occurs when semi-solid foods are introduced after 6 months of life during weaning. It frequently occur. Here, frequency of stool become reduced at least 2 or less than 2 per week. Child frequently requires hard stool and painful defecation. There is something known as the withholding maneuver, which I already described, also known as gentle posturing, in which the child stand while passing stool. The child stand on their toes. They cross their legs frequently. At times, they hide behind the doors or the cot with flushing of the face. All these are attempts to retain the stool, but perceived by the parents as the other way around. There is one term known as fecal incontinence. In it, a small amount of fecal matter stains the undergarment in presence of impacted rectum. It is frequently a sign of constipation. So, what parents can do for the management of this functional constipation? What parents must understand, there are three components of treatment of functional constipation. First is the diet, second is toiletry habit, third is the medication. Parents must understand the treatment of constipation, duration of constipation is at least 3 to 6 months. What happens? Parents give treatment for 10 to 15 days. When pattern becomes normal, they stop treatment. Again, after 10 to 15 days, child again develops constipation. The vicious cycle keep on occurring, and the child is unnecessarily feeling the pain of doing defecation. The first is the diet treatment. The diet is should be rich in the fiber. Child should intake plenty of water, and there should be decreased milk intake. Frequently, after 6 months of life, parents keep on giving the milk, large amount of milk. They are not giving enough semi-solids. Milk does not have fiber. That is very frequent cause of constipation. Milk quantity should not be more than 500 ml per day after 6 months of life. They should give at least 3 portions of semi-solid fruit and 2 snacks per day, which should be contain the enough fiber amount for the stool formation. There are certain foods which are very beneficial in constipation. That is apple, pear, and guava with peel. Apple is very beneficial because apple contains sugar, which retains the water in the stool. Whatever things which makes the stool soft in intestine, which will help in the constipation. This is the only condition we prescribe fruit juices. In less than 1 year of the age, child can be given apple juice and prune juice for the constipation. Toilet training is the second part of the treatment. If child is more than 2 years of the age and ready for toilet training, child must sit on the toilet for at least 5 to 10 minutes at fixed time of the day, frequently after 30 minutes of the major meals. There is rule of one. Only one caregiver should give the for attend to the child. There should be one fixed routine. There should be one fixed place, and only one word for the training. Whether caregiver should use the potty or poo training. Only one word can be used. Child can be rewarded for the toilet training. One must be very patient during toilet training because it takes 3 to 4 weeks for the establishment of stool pattern. So you must be consistent in toilet training the child. Third is the pharmacotherapy. You must understand the hard stool is there in the rectum, and rectum is very malleable structure. When any hard stool present in the rectum for very prolonged duration of time, diameter of the rectum become increase. So it absorbs the water, stool become very hard. So one is first a treatment of pharmacotherapy is disinfection. Disinfection can be done by two methods. First is some certain oral drugs which can which when given in large amount, it melts the hard stool, and the hard stool child can pass the hard stool. Otherwise, we can use enema also. When I told you, the atrial diameter when increase, it takes times to become regains its normal caliber. It takes at least 3 to 6 months. It is where maintenance therapy occurs. In here, certain drugs like polyethylene glycol, lactulose are given in certain dose as per the weight of the child for at least 3 to 6 months. So parents must remember that they should not stop medicine after 10 to 15 days. Should give medicine to 3 to 6 months and just taper the dose as per your physician advice. And do this treatment of 3 to 6 months. Focus more on diet, water intake, and at least 1 hour physical exercise, physical activity daily, along with toilet training. Most of the children become treated with the functional constipation within 3 to 6 months of life. And some children might require treatment for 9 to 12 months, depending upon the condition of the baby. But almost all the children can be treated with functional constipation if these three components of diet, toilet training, and medication are accurately given. Thank you. Now I'm ready to take a question. First question is, how much glass of water is required for child to avoid constipation? It depends on the age of the child. If the age is between 6 months to 1 year, you can give water after major meals as much as child wants. As much as child, after 1 year, you can give half to 1 glass of water every 2 to 3 hour interval. At least half to 1 glass of fruit juice can also be given. And physical activity is also very important during this after 1 year of the age. At least 1 hour of physical activity, decrease screen time should be given. Keep focus on dietary fiber as I prescribed. Give vegetables, fruits with peel also. Any other question?
So there is a myth what every parent has that having or a small a small kid in the age group of 0 to 6 months who keeps pooping, it's common. So is that a right thing to consider?
What? So again, pardon?
Yeah, so there is a, I mean, everyone says it is obvious for a child, a small child, to keep, vomiting or having no, constipation is common. So is that a right thing to consider, or is there a way of how to handle these questions?
In less than 6 months of age, if child is formula feeding, stool frequency of one per day to once in 5 to 7 days is also common. Should not give the should not be overly in excess for this stool frequency. It is quite common. If child is not able to pass to a stool for 3 to 6 days, more than 6 days, then you should contact your doctor. Is constipation in child is harmless? No. Constipation actually hard stool causes the ulceration of the anal area, so it is not a harmless. It's become very painful for the child for defecation. So child avoids the painful defecation. For this, you have to give again. I am stressing now about detailed dietary fiber, adequate water intake, physical exercise, dietary habit, as well as depending on the severity of the constipation, you have to keep certain medication also. So constipation is not a harmless. You must treat the child as per condition of the baby. No, many packaged fruit juices contain sugar, so it is not advisable to give packaged juices or lemon juice. Lemon juice does not contain fiber, so it is not advisable to give lemon juice or packaged fruit juices to the baby. We usually prescribe the fresh fruit juice which can be prepared at home. Like apple juice and prune juice are very important because they contain sugar, which absorbs the water in the intestine and make the stool soft. Okay, so please give the child freshly prepared juice at home for treatment of constipation, not packaged juice like Tropicana, Fruity, etc. Thank you everyone for patiently hearing the question.